stark contrast with China, where the first major car show went ahead this week in Shanghai.
OK, Mariko, thank you very much for your time. UK closes its doors to India as coronavirus infections hit world record levels. Now, new restrictions for people travelling to the UK from India have now come into force. The country has joined the UK's red list, which effectively bans travel. India has seen record infection rates, a rapidly rising death toll, and the discovery of a new virus variant. And 6 hospitals in the Indian capital, Delhi, have now completely run out of oxygen. Caroline Davies reports.
The last few arrivals before India is added to the red list. There was joy for those who made it back.
It's amazing, honestly. It's amazing. I feel like kissing the ground.
Aditya had travelled to India for his grandmother's funeral.
It was expensive, I must say that.
Expensive?
Yeah, just like triple the time, the prices I paid. But yeah, I'm finally happy that I'm here.
Yesterday, India saw the highest one-day tally of new COVID-19 cases anywhere in the world. Crowds built outside hospitals in major cities as they reached capacity, and there were reports that some died while waiting for oxygen. Shankar Baheti's family spent the day searching for oxygen for him. His niece told the BBC his relatives drove 5 hours to find a supply yesterday. They'll have to do the same again today.
It's distressing. I can't imagine what his daughter, who's younger to me, my cousin, and his son, they must be going through right outside the hospital. They're stationed outside and running here and there at every lead to get to fill a cylinder or to get that oxygen.
The so-called Indian variant of the virus is still being investigated. Today's new restrictions in England mean anyone arriving from India from 4 a.m. this morning must quarantine in a hotel for 10 days at their own expense. Quarantine hotels like the Sofitel at Heathrow have been running for more than 2 months. The management told the BBC its sister hotel in Gatwick has just opened, employing an extra 100 people, expecting demand to go up. While the industry waits, hoping international travel will reopen next month, England's red list of countries gets longer as countries confront new waves of the virus. Caroline Davies, BBC News.
And just a reminder of our top story before I go. More than 100 people are reported to have been hurt in clashes in East Jerusalem. You can reach me on Twitter. I'm at @VFritz This is World News. I'll see you very soon.
Moment we started yesterday morning.
I don't know how we will go back.
Filmed across the world, Pandemic 2020. All episodes streaming now on BBC iPlayer.
The creep.
Adrenaline. Uncertainty.
Lights dimming.
Dancing.
Camaraderie.
The applause.
If only for a short while. Truly alive.
Live theatre lights up BBC4 this spring.
People say a lot of action.
Greta Thunberg, a year to change the world. All episodes streaming now on BBC iPlayer.
Streaming now on BBC iPlayer.
Good morning. Welcome to Friday, the 23rd of April, St George's Day. At 6 o'clock now on BBC One, Breakfast.
Good morning. Welcome to Breakfast with Ben Thompson and Naga Munchetti.
Our headlines this morning. The UK closes its doors to travellers from India as hospitals there run out of oxygen and infection rates hit levels unseen anywhere so far in the pandemic.
All arrivals into the UK will be red list arrivals, so passengers face 10 days in quarantine.
Good morning. It's Friday, the 24th of April. Our top story is that new restrictions for people coming to the UK from India have come into force this morning as the country joined the UK's red list, which effectively bans travel.
India has seen record infection rates, a rapidly rising death toll and the discovery of a new virus variant. 6 hospitals in the Indian capital, Delhi, have now completely run out of oxygen. Caroline Davies reports.
The last few arrivals before India is added to the red list. Caroline Davis, BBC News.
Let's talk to our reporter Tim Muffett, who's outside Heathrow Airport for us this morning. Tim, morning to you. Now, we do know, now that this travel, India is on the red list, we still know that there are a number of flights due to arrive from India today.
That's right, yeah. There were already 39 countries on the red list, including Brazil, Argentina and Pakistan. But from 4 a.m. this morning, as we heard, India has been added to that list, so there are now 40. Now, anyone travelling from India to the UK will be refused entry unless they have a UK or Irish passport or residency rights. Then they face that 10-day quarantine and a government-approved hotel at their own expense. Now, we understand the last flight to make it in before the red list kicked in was just before 7 o'clock last night. And as you say, there are some flights due to arrive from India today, but those now will be red list arrivals. One of them is due about 10 past 7. It's now probably coming in about 8 o'clock. That's a Virgin Atlantic flight from Mumbai. And Virgin Atlantic have confirmed that all the people who got onto that flight had to prove that they had a booking at a government-approved quarantine hotel. So this is clearly going to cause a huge amount of disruption, as we saw in Caroline's report a little while ago. And the situation in India does seem very, very desperate. Soaring infection rates, some hospitals are overrun, and that is why India is on the red list. Public Health England confirmed yesterday that a further 55 cases of the variant first seen in India have now been found in the UK, taking the total to 187.
Yeah, there's some really scary, frightening figures. Tim, thanks very much. Tim Muffett there.
The convictions of around 40 former postmasters who were accused of stealing money from the post office.
Media forecast.
Right, I'm back with the latest from the BBC London newsroom in half an hour. There's plenty more on our website. We'll see you soon. Bye-bye.
Good morning to you. You're watching Breakfast with Ben Thompson and Naga Monchetti.
Good morning to you. It's just turned 6:30. Now, we've been hearing this morning how a devastating second wave of coronavirus is sweeping across India, pushing the country's healthcare system to the brink.
We're joined now by our correspondent, Nikhil Inamdar, who's in the state of Maharashtra, one of the hardest hit regions. Nikhil, good to see you, but the fact that you're telling us about just how difficult the system is coping in terms of coping with just the sheer numbers infected and severely ill.
Absolutely, Naga. I mean, it's a very, very grim situation. Yesterday, India shattered a global record of sorts with about 315,000 fresh new infections. Today, that tally has jumped to about 330,000+, with over 2,200 people losing their lives. Meanwhile, the news that we're getting from hospitals is absolutely devastating. One of Delhi's largest hospitals, the capital, actually saying that 25 of their sickest patients had died because the ventilators were supposedly not working. They've also been putting out SOS calls for oxygen cylinders. Many hospitals have, in fact, been doing that, saying they have just barely a few hours of oxygen left, some even completely running out. So there's an oxygen crisis of sorts in the country. People are also scrambling to get beds, ventilators, and there's also a shortage of essential treatment drugs such as remdesivir. Now, amid all of this, the Prime Minister Modi is actually going to be chairing a meeting of state ministers where COVID has been the worst, or rather states that have been worst hit by COVID. He's also going to be taking stock of the oxygen supply situation. But for now, the situation on the ground is absolutely not good. And we've also heard of yet another tragedy in a city close to Mumbai this morning, in a city called Vasai, where 13 people lost their lives after a fire at an ICU in a hospital.
Very, very grim situation. Thank you very much for bringing us up to date.
Let's discuss this now with one of our regular GPs here on Breakfast, Dr Mohit Mandiratta, who joins us now from Birmingham. Mohit, good morning to you. We were hearing there some of the devastation that this is causing, particularly on the health service and on hospitals in India. Just how concerned should we be here about this emergence in India?
Good morning. I think, we've heard the shocking statistics. We've seen the desperate images this week of what's going on in India. I have family in India and Delhi, and actually a couple of them are in hospital, lucky enough to be in hospital at the moment, being treated for COVID. I think, we're hearing all of these about oxygen supplies running out, hospitals being overwhelmed, makeshift funeral pyres being made. It's difficult to draw direct comparisons because the infrastructure of the country, the geography, the population density, their healthcare system is very different. But clearly there has been an impact of the decisions made. There's no restrictions in mass gatherings, weddings, religious festivals, cricket stadiums have been full, election rallies have been going on. It's made me reflect on how many families here and across the world have been torn apart by the pandemic. So it is a really desperate situation. I know many will be worried about loved ones in India and other countries abroad. And although treatments, vaccines may be different, I think there is a universal piece of advice we can give to everybody. I'm being asked things by family in India, and that is the hands, face, space, fresh air guidance. That applies to everybody. That's the best way to protect yourself. But certainly, really, really sad situation there.
Yeah, and Mohit, there was a feeling, wasn't there, that India had been spared the worst when many other countries were going through their first and second waves. India seemed to be relatively unaffected. What do we know about why there's been such a spike right now?
I think it comes down to potentially complacency, maybe. As you've said, numbers were low, and actually death rates comparatively to other countries have remained quite low. But clearly, as I've said, potentially the decision to allow mass gatherings have had an impact. Obviously, there's investigations going on into the variant, so the double variant that's in India at the moment. And I know there's a few cases here. We don't know if it's a variant of concern yet. So the numbers in this country are still quite small. But obviously there is research and evidence gathering ongoing to look at whether it is more transmissible, whether it's less responsive to vaccines or the treatments that we're offering. But obviously it's difficult to put it down to one reason. But certainly the complexity of the country, the population density, the vaccination program there, although the numbers are very high, I think over 130 million vaccinated, in terms of the proportion of the population, over 1 billion people, they're far behind where we are. And we're lucky to be where we are at the moment in this country, stepping out of lockdown, and grateful to have the NHS.
Yeah, absolutely. And you mentioned those variants that are here in the UK. I think latest figures suggest 103 cases of this India variant now reported in the UK. What do we know about vaccine sort of efficiency, whether the vaccine works against this strain, and whether people should be changing their behaviour here? We know, for example, and we've been talking about this at the start of the programme, flights now restricted. People coming from India, if they are allowed into the country, will have to hotel quarantine. But should we be worried?
I think absolutely the right decision with the red list. I think, we don't want to undo the progress that we've made here over the last few months, the hard work everyone's put in by following the restrictions and obviously the vaccination programme. Difficult to say yet because obviously that research is ongoing with this new variant and the South African variant. And there's a lot of work from our public health colleagues and local authorities to sort of deliver surge testing in areas where these variants are found so we can really clamp down on any spread. But, as we're unlocking, I think the important thing is we still exercise caution. So although numbers are low, make sure you're keeping your distance, you're washing your hands, you're wearing masks, you're not meeting indoors. Please ensure you're meeting outdoors because it is important we protect ourselves. And although the vaccination numbers are great, there are still significant numbers of people who A, haven't been vaccinated, or B, maybe in at-risk groups and haven't taken up the offer of a vaccine yet.
As always, it's so good to get your thoughts, Mohit. Thanks very much, Dr Mohit Mandiratta there with the latest on that India variant and the cases in India that are soaring and putting so much pressure on the health services there.
6:36 is the time. Yeah. Good morning. Welcome to Breakfast. You're with Ben Thompson and Naga Manchetti.
Good morning. Our headlines for you at 7. The UK closes its doors to travellers from India as hospitals there run out of oxygen and infection rates hit levels unseen anywhere so far in the pandemic.
Flights arriving in the UK from India are now red list arrivals, so passengers face 10 days of quarantine in a hotel.
The post office scandal.
Hello, good morning to you. It is Friday the 23rd of April. Our top story today. New restrictions for people coming to the UK from India. They've come into force this morning as the country has joined the UK's red list, which effectively bans travel.
India has seen record infection rates, a rapidly rising death toll and the discovery of a new virus variant. 6 hospitals in the Indian capital, Delhi, have now completely run out of oxygen. Caroline Davies has more.
BBC News.
Now, our reporter Tim Muffet is at Heathrow Airport for us this morning. Morning, Tim. So there are a number of flights due to arrive in the UK from India this morning. What will happen to those who have been allowed on those flights?
Well, as you say, the red list is now in force with regards travel from India. So there are 40 countries now on that list. And the last one to arrive here before that came into force came in just before 7 o'clock last night. Now, there are, as you say, some flights still due to arrive today. One of them, a Virgin Atlantic flight from Mumbai, is due to arrive in the next few minutes, actually more like 8 o'clock now. And Virgin Atlantic have confirmed that everyone who got onto that flight had to prove that they had a place reserved in a government-approved hotel where they will have to quarantine for 10 days. So clearly this is huge disruption. We also understand that 4 airlines asked for 8 more flights to be allowed in before the 4 a.m. deadline this morning, but that was refused. Bosses here at Heathrow didn't want to put more pressure on Border Force, the people part of the Home Office who enforce passport controls and such like, because there have been really long queues recently, so those requests were refused. Clearly the situation in India is highly concerning. A huge number of cases, many hospitals overrun, and that is why India is now on that red list.
Tim, thanks very much. That's Tim Muffet there for us at Heathrow Airport.
And also that people with long-term health conditions were equally well protected by vaccinations. We've seen good protection from 1 dose of vaccine, but we've seen that you get the best protection having had a 2nd dose of vaccine. So we'd really like to encourage people to take up the opportunity to have a 2nd dose of their vaccine once this is available.
The next stage of the research is to find out how long the jabs continue to protect people in order to decide when to begin the next round of vaccinations. Palab Ghosh, BBC News.
We're joined now by Professor Sarah Walker, the Chief Investigator of the study. Professor Walker, thank you very much for joining me this morning. Now, this is positive news. Is it more positive than perhaps was originally thought in terms of the effectiveness of the vaccine?
It's always really challenging because, trials give us the best estimate of how well a new drug or vaccine works, because they look at people who are similar in every characteristic, some who get the drug and some don't. But the challenge is that often older people and people with long-term health conditions don't go into those studies. So our study is in the general population. It's a random selection of households across all 4 nations of the UK. And so it really gives us a real world estimate of how the vaccines are performing, outside of a much more controlled environment. So yes, from that point, it's really good news. We show great protection in people who are older and younger and who report and don't report these long-term health conditions. And also, very importantly, against the Kent variant. So the trials were conducted before that was really very common, whereas actually many of the infections in our study were the Kent variant. So we're able to show good effectiveness against that strain.
Is the study still going on?
It certainly is. It reports every week. It's a major partnership with the Office for National Statistics. And so you report it every Friday and commonly in the week as well. And it will be going on for at least the next year to really try to understand how long protection that we're getting from these vaccines lasts, when we might need a booster, exactly how much protection in terms of antibody responses is needed to stop people getting coronavirus at the same rates.
We should say, however encouraging this is, just because you have been vaccinated 1 or two jabs, you can still transmit coronavirus.
So this is a really critical finding. So because the survey tests people every month, regardless of whether or not they've got symptoms, we're able to look at infections that people don't know they've had, and also infections with much lower levels of virus. So whilst we still show benefit from 2 doses and even from previous infection against those infections without symptoms and with less virus, they are not 0. And so yes, people can get COVID again. They will get it less severely, so it's great news for an individual, but they will definitely have the ability to pass it on again, even if the ability is much, much reduced because there's much, much less virus there. So it's really important to understand that it's not 100% protection. And of course, everyone who gets coronavirus is an opportunity for the virus to mutate again. And we can see the havoc that new variants are causing across the globe. So there's a real responsibility there, as well as an enormous benefit from vaccination.
Now, you mentioned how when you were doing the trials for this set of data, you were able to take in the Kent variant. Of course, you will be very well aware the horrifying situation in India at the moment, but also the fact that the India variant, there have been, I think the Health Secretary, Matt Hancock, said there have been 103 cases in the UK. So as the trial goes on, will you be looking specifically at that as well and the effectiveness of the vaccine against that?
So the survey is really large. So we included around 370,000 people in this study. Obviously, it will really depend whether that variant becomes much more common in the UK, like the Kent variant did in December. Obviously, everyone's working incredibly hard to stop that happening, and that's why there's all the surge testing. But definitely, over the next year, we will continue to look at the effectiveness of the vaccine against whatever strains are circulating in the UK.
You know, one of the things that hasn't been clear to me, and there was a lot of speculations about how long antibodies last. So, there's half the population which hasn't had the first vaccine yet and won't for a good few weeks, maybe even months. So if you've had coronavirus, do we have any, or do you have any firm data on how long antibodies last?
So there have been a few studies, and what they show is whilst the levels do decline, they probably stay at high enough levels to give at least some protection for at least 6 months. I mean, obviously, we've only had coronavirus around for a year, and studies took a while to get going. So those are the data that, that we're still really getting. We're now trying to take blood from over 150,000 people a month in the survey, and so understanding how long you protection lasts in both people who've had vaccine and people who've had previous infection is a key goal of the survey over the next year.
It's always good to talk to you, Professor Sarah Walker, because you always come on and tell us the results and kind of explain it in language that's digestible and understandable. So thank you so much. And that is Professor Walker, Professor of Medical Statistics and Epidemiology at the University of Oxford.
Exactly what we need right now. Clarity. Keep it simple. It's 7:23. Good morning.
I'm back with the latest from the BBC London newsroom in an hour. There's more on our website, of course. We'll see you soon. Bye-bye.
Hello, you're watching Breakfast with Ben Thompson and Naga Monchetti.
It's 7:33. Good morning. Now let's return to our top story, the news that India is in the grip of a devastating second surge of COVID-19. Yesterday, the country recorded the highest one-day tally of cases anywhere in the world.
Many families across the UK have loved ones in India and are now watching, feeling pretty helpless as its healthcare system is pushed to breaking point. Our correspondent Seema Katecha has more.
Much of Britain's vast South Asian population originates from India. For many, there remain strong family links. So the seismic explosion of coronavirus cases over there is causing great concern and panic over here.
Hi, Mum. Hello, Sonu. All right, Chotu? You're right.
Ranjan's daughter lives just outside Delhi, along with her 2 children and husband.
I'm like paranoid and keep phoning them and saying, don't leave the house, don't leave the house, don't do this, yeah. But, fair enough, they may not do it, but there's other family out there as well, in Gujarat and my others, cousins and things like that, and they're in the villages and stuff like that, and they also they're not in the same environments. Every environment in India is different, isn't it?
The COVID backdrop makes her daughter often feel scared and lonely.
We are doing everything we can to protect ourselves and build our immunity against it, I suppose. It is very isolated. I do miss my family heaps, and vice versa, they're missing us.
The second wave of the virus is ferocious, A nationwide oxygen shortage meant scores of patients dying in the western state of Maharashtra yesterday after their ventilators shut down. Locals are alarmed and bewildered.
It's pretty bad.
After their ventilators shut down. Locals are alarmed and bewildered.
It's pretty bad. The sad thing is that we are running short of medication. We are running short of hospital beds. We are running short of ventilators. So that's what it is right now. Few family members are at a very critical stage right now. In fact, one of them is getting admitted in a hospital in Delhi. It was not easy getting a bed for one of our relatives, and it's just that's what the situation is. We're not safe.
Some are blaming the government. Religious festivals and other large public gatherings have been allowed to continue, attracting millions.
We have to be very careful about, we knew that at least for the next 2 years, we have to, maintain a little bit of distance. But yeah, the government could have done a lot better. They could have seen this coming, and they could have avoided certain gatherings.
India has been manufacturing the AstraZeneca vaccine, supplying countries across the world. This week, COVAX, the group assigned with distributing vaccines to poorer nations, said it will reduce the number of doses sent to other places after India stopped exporting them to help at home. Some believe Britain needs to step up its international support.
Well, the UK government can do a lot more than it currently has. Firstly, it has talked about the surplus vaccines that we will have. What it hasn't done is actually state how many surplus vaccines we are likely to have and what is the timeline of us being able to give those either back to the COVAX facility or have bilateral agreements with places like India, for example. Clearly, the government hasn't just given any details.
A Number 10 spokesperson said there had been no request for help from India, but that it would consider any request very closely, as you would expect. From 4 a.m, India will be put on the red list, so most people who have travelled from there will be refused entry to the UK. For those here who call it their motherland, India's crisis is theirs too.
What does India mean to you as someone of Indian descent?
India means home. My heritage, my culture, everything is from India. My children grew up with that as well. So I feel deeply about people and the situation out there, but at the same time feel helpless. What can we do from here?
Yeah, that's the question. Well, earlier this month, Nayan Gangyang travelled from his home in London to northern India to look after his parents. They had both contracted coronavirus.
Yeah, he's hoping to fly back this weekend, but will, as you've heard, face a 10-day quarantine when he arrives back here. Let's speak to Nayan now, and also to his wife Varni, who is waiting for him back in the UK. Good morning to you both, to Nayan and to Varni. Nayan, let me start with you. Maybe you can explain a little bit about the situation where you are right now, given everything we've heard about the toll the pandemic is taking on the health services there.
Yes, the situation is exactly as it was mentioned earlier in the show. It is really bad, and I was exactly in the same situation a few weeks ago, where when my dad's oxygen levels started to drop, we tried to get him to a hospital, and there were no beds. My mother started to panic, and I was in the UK and couldn't help. I was totally helpless, and it was at that point in time that I decided that my family needs help, and I need to go back, come what may.
And what help have your family been able to get?
So India has both private and government healthcare system. The government healthcare system is completely overrun right now. So we had to reach out to the private side, and even there were not any beds available. But we had family, and like we knew the doctors who were treating my dad, who's actually a liver transplant patient. So he's got a history of medical illness with that specific hospital, and the doctors really pulled whatever they could in order to get him admitted a few weeks ago. And thankfully, the first night he couldn't. They had to return back from the hospital. The second night, he managed to get admitted. He was there in the hospital for about a week, and then he got better.
Yeah, and I wanted to say, how is he doing?
He's doing much better now. He was, even after discharge, he was on the bed for 10 days. I think he's got something like the long COVID because of the infection spreading to the lungs. But yeah, he's thankfully he's getting better slowly but surely.
Varney, let me bring you in at this point because, of course, you're forced to watch from a distance whilst family in India is facing some of these problems. How difficult has it been for you to be able to provide support to Nayan and to the rest of the family?
It's not been difficult to provide support. I think it's just difficult to watch from a distance and know that there's not much you can do or not much you can influence. So yeah, it's just difficult. I think providing support is the easy part. It's difficult to kind of watch the events transpire and then not be able to control or influence it, right? Like the fact that then now when he comes back has to quarantine for 10 days in a hotel. We did what we could to try and control that and try to influence that, but to no avail.
Yeah, and certainly initially, when other countries were facing their first or second waves, India appeared to be relatively unscathed by the pandemic. And then within the last few weeks, we've seen the number of cases soar. But I know, Varney, you said you felt particularly comfortable that Nayan could travel there because Boris Johnson, the Prime Minister, was also planning a visit.
Yeah, so and we talked about this at length, right? The moment he got to India, actually, we were already planning his return because we knew the situation was getting really bad. Boris Johnson's visit, it happened to be 2 days after Nayan's scheduled flight, so on April 26th. So that sort of gave us a sense of security that, if we think the UK Prime Minister is going to be visiting, then the travel lines between the two countries will be open. So we were comfortable with his return. But yeah, like you said, obviously, Boris Johnson's visit got cancelled. As a result, we got just over 3 days' notice. So very little time for us to actually affect the outcome or do anything about it. So unfortunately, we're just in this position where we have to just, I guess, be okay with the fact that after Nayan's ordeal in India, he has to sort of go through another ordeal over here in hotel quarantine.
Yeah, and let me ask Nayan about that. So Nayan, your flight, I understand, is booked for tomorrow. What do you know about the flight, whether it is running, and what will be required when you get back to the UK?
Yeah, so the flights, as of now, it's running, but the airlines for a long period of time have been saying that there is no guarantee that it'll fly until it takes off. So I'm really hoping that it does take off tomorrow. I know that once I land in the UK, I've already booked my quarantine hotel, so I'll be going straight there. It's actually right next to Heathrow. So I'll be just landing at Heathrow and straight to the hotel and 10 days in the room.
I wish you both well, particularly Nayan, of course, with taking that flight and then the quarantine that you'll undertake when you get back. So I really do hope you are able to be reunited when you get back. But thank you for talking to us this morning on BBC Breakfast. Thank you to you both.
Thank you.
Thanks.
As well.
Yeah.
We're joined now by Dr Sakthi Karunanidhi, who is the Director of Public Health for Lancashire. Dr Sakthi, good to have you with us again on the programme. Just tell me, you've got colleagues and friends in India. You tweeted not so long ago you were wishing them well. Just from here and the view in terms of what you're seeing, how do you feel about what's going on in India and the situation the country's in?
I mean, my thoughts are with my friends, my family, and my ex-colleagues who are on the front line, but also with the families who lost their loved ones during this catastrophe. I think we must not forget during this catastrophe. I think we must not forget that this is not just a catastrophe and a disaster in India. It's a warning sign for all of us across the world, and we are not out of this yet. So it's clearly a very, very escalating situation in India, and we must watch very carefully. And we're still waiting to find out about this virus and what this variant actually does. It's just a signal that's not all over yet.
Well, we know that I think the Health Secretary said there are 103 cases of the variant here. We can talk about that in a moment. But just to focus on India, you've said that we need to watch. The Indian government has said that it needs to import 50,000 tonnes of medical oxygen as those cases increase. There have been talks about Russia perhaps giving remdesivir treatment and oxygen. You say the world has to watch. What more should be done?
Yeah, I think it's not just watching. It's also, it needs a truly international endeavour. And it requires action from, multiple partners, ranging from vaccines to supplies, and also sharing the intelligence and mobilising our scientific capacity to support this effort. And I think that is happening to a large extent, but more can be done certainly on the vaccine front. But this current disaster is something that we can't do much about it now, other than bailing it out through efforts of the healthcare system and really supporting the families through this period.
And of course, India is experiencing this on a much larger scale, but we mustn't forget the two waves that we've experienced here in the UK and the pressures we saw on the NHS and our systems. What have we learned, and what advice or experience can we pass on that could help this situation now? Or do we simply just have to, does India simply have to see this play out?
I think with the current events, it really has to play out, and how strong the healthcare system is in any country will determine the outcomes of the immediate crisis. But I think from the UK perspective, we've learned to anticipate things, and we've also learned the importance of data and the importance of science and research pretty much live, real time, to track this virus and to continue to keep our communities informed and protected with what appears to be waxing and waning, as you normally expect with any virus and this variant. But we simply have to be very patient in our efforts to relax the restrictions. Certainly, the international travel aspects of this, we are seeing, as the cases are at their lowest in our part of the world, the proportion of cases associated with travel is on the rise. And this must be a warning sign for plans to lift the restrictions for the next steps ahead.
What firm data do you think is needed? Because we've been told by the government that no date in terms of the path out of lockdown has been set, but the data will dictate whether we can stick to the timetable. So specifically in terms of international travel, and you've been very clear about a cautious approach being needed, what data would mean that those dates are pushed back and pushed away?
I mean, I'm talking particularly about the international travel. And yes, vaccines are doing a great role here in this country, but still only 20% of us are fully protected with double doses. And clearly the rest of the world isn't. So one of the things that we really need to watch is the scale of this issue and people traveling, how many of them have been found testing positive. And clearly we could do a lot more in terms of protecting ourselves on this side of the border on the flight by introducing tests on arrival. At the moment, you can get yourselves tested 3 days before travel, and until 2 days after travel, you don't get a test. I think we could do more on that in terms of testing on arrival, so we can detect these cases early and support people with quarantine and isolation. And it is not just about the COVID. The scale of this issue means that there is a lot of anguish in our communities, at least to say mental health, but also children missing their schools, and simply the financial ability to pay for your quarantine. And this on this scale, there's quite a number of complex issues that we need to really unpick, particularly related to the international travel and this emerging from across the world.
As a Director of Public Health, would you go as far to say as we should not open up international travel as planned at this moment in time?
I think there is a case for it. We all need to understand this variant and its relative advantage of the current strain over the current strain that's circulating in Britain. But certainly, I would advise caution against international travel on the 17th of May before we understand this virus. And actually, I would go a bit further to say we probably need to protect a lot more people with double doses of vaccine before we can consider international travel in its fullest sense.
Very clear message. Thank you very much, Dr. Sakti. Karen Aniti, who is the Director of Public Health for Lancashire County Council, thank you.
You could hear the bird song there. It's beautiful. Tell you what else is looking beautiful. Let's speak to our reporter Tim Muffet, who is at Heathrow Airport this morning. Tim, good morning to you. Flights from India still landing this morning, one just arriving.
That's right, about 5 minutes ago, the Virgin Atlantic flight from Mumbai landed. So that is the first flight to land in the UK with India on the red list. Now, Virgin Atlantic confirmed that before passengers were allowed onto that plane in India, they had to prove that they had a booking at a government-approved hotel where they'll have to quarantine now for 10 days. We also understand that 4 other airlines asked for 8 additional flights to be allowed to land before 4 a.m. with more passengers from India, but those requests were rejected because Heathrow bosses don't want to put more pressure on border force staff. They're the part of the Home Office which oversees passports and such like. There have been long queues here in recent days, so they didn't want to add any more pressure there. Clearly, huge disruption, a growing, concerning problem in India, which is now on the travel red list.
Tim, for now, thanks very much. Tim Muffet there at Heathrow.
Vaccines should be able to control the coronavirus pandemic, according
the huge sums of money the government has been forced to borrow.
Colder air mass, so it is going to feel a little chillier as we head through Sunday. The cloud, though, burning back through the afternoon to some sunny spells, but still no significant rain in the immediate forecast.
Right, so I'm back with the latest from the BBC London newsroom in half an hour. There is, of course, plenty more on our websites at the usual address, bbc.co.uk/London. See you soon. Bye-bye.
Hello, you're watching Breakfast with Ben Thompson and Naga Monchetti.
Good morning. Morning Live follows Breakfast on BBC One, so let's find out what's on the show with Kim and Gethin. Morning.
The fitness workout to finish off the week perfectly.
D-Buzz on a Friday. Ben, I'm not sure if you've done a Strictly Fitness yet. Are you ready for one today?
I have heard all about them. I have not taken part just yet. We may see you later.
Today's the day. We'll see you later on.
Thanks to you both. See you in a bit.
We're going to take some time now to remember a voice and a face which graced tens of millions of teenage bedrooms during...
Hello, good morning and welcome to BBC News. New restrictions for people coming to the UK from India have come into force this morning as the country has joined the UK's red list, which effectively bans travel. In the past couple of hours, India has reported the biggest daily rise in infections of any country since the pandemic began, nearly 1/3 cases for the second day in a row. The country is seeing a rapidly rising death toll and a new variant of the virus has been identified. 6 hospitals in the Indian capital, Delhi, have now completely run out of oxygen. This report is from Caroline Davis.
England's red list of countries gets longer as countries confront new waves of the virus. Caroline Davis, BBC News.
Earlier this morning, our correspondent Nikhil Inamdar, who's in the state of Maharashtra, told the BBC how hospitals are now facing an oxygen crisis.
It's a very, very grim situation. Yesterday, India shattered a global record of sorts with about 315,000 fresh new infections. Today, that tally has jumped to about 330,000+, with over 2,200 people losing their lives. Meanwhile, the news that we're getting from hospitals is absolutely devastating. One of Delhi's largest hospitals, the capital, actually saying that 25 of their sickest patients had died because the ventilators were supposedly not working. They'd also been putting out SOS calls for oxygen cylinders. Many hospitals have, in fact, been doing that, saying they have just barely a few hours of oxygen left, some even completely running out. So there's an oxygen crisis of sorts in the country. People are also scrambling to get beds, ventilators, and there's also a shortage of essential treatment drugs such as remdesivir. Now, amid all of this, the Prime Minister Modi is actually going to be chairing a meeting of state ministers where COVID has been the worst, or rather states that have been worst hit by COVID. He's also going to be taking stock of the oxygen supply situation. But for now, the situation on the ground is absolutely not good. And we've also heard of yet another tragedy in a city close to Mumbai this morning, in a city called Vasai, where 13 people lost their lives after a fire at an ICU in a hospital.
Nikhil Inamdar there. Well, let's head to Heathrow Airport. Our correspondent Tim Muffet is there for us. Morning to you, Tim. And I think a flight arriving from India quite recently there. Are the hotels around the airport expecting to be really busy with people coming in now and having to quarantine as a result of the country going on to the red list, the UK's red list, from early this morning?
Yeah, it's an odd way to arrive into a country, isn't it? As you say, just over an hour ago, a Virgin Atlantic flight arrived from Mumbai. So that was the first flight to arrive in the UK from India, whilst India is on the red list. Just to recap, at 4 o'clock this morning, the 40th country to be added to the red list, India, that happened. And so that means that anyone arriving in the UK from India will either be refused entry or allowed entry so long as they have a UK or Irish passport or residency rights, in which case they then have to go to a hotel, a government-approved hotel, and quarantine for 10 days. Now, Virgin Atlantic was saying that they had to ensure that everyone on that aircraft had proof that they had a booking in a hotel, otherwise they would not have been allowed to fly. And we also understand that 4 separate airlines requested for 8 additional flights to be allowed to land here this morning before 4 o'clock to beat the deadline, but that was refused. The authorities here at Heathrow just weren't prepared to put that added pressure onto Border Force, which is the part of the Home Office which oversees passports and entry into the UK. So that was not allowed. So clearly many very frustrated people who were unable to come back. As we saw in the report a few moments ago, desperate stories. People really needing to come back for work, to see family. And for those people who are doing so now, they face 10 days in a government-approved hotel, and they will have to pay the costs themselves.
OK, Tim, thank you very much. Tim Muffet there at Heathrow Airport. If you've got a family member who is now going to return to the UK and needs to quarantine, as Tim was explaining there, in a hotel, whether it's at Heathrow or at another location, do get in touch with us and tell us about the situation that they find themselves in. You can do that on Twitter at Anita_McVeigh and use the hashtag BBC Your Questions, and we'll try to read out a few of your comments. Now, it's been called the most widespread miscarriage of justice in UK history.
You know, and they told us all we're the only ones. And I mean, we're the tip of the iceberg. There's thousands more in a shortfall scheme. There was 500 of us that took them to court. So it's been a massive cover-up.
Now, there are 2 things the Court of Appeal is ruling on today. First of all, and the Post Office isn't contesting this, that all of you involved in this, the postmasters, postmistresses, couldn't and didn't have a fair trial. And I know a lot of you want a judge-led inquiry into this. Do you support that?
Yeah.
What would that give you?
I mean, we will find out who did what, when, and who knew what and when. And then I really do believe that those that knew what was going on should be held account to it.
The way that you were, falsely.
Yes. Oh, I would love to see that day. It would be amazing.
Yeah.
Let them have some of what we've had, you know.
Jo, thank you so much for talking to us. Maybe we can talk to you again later afterwards, and certainly from some of your colleagues who worked for the Post Office and who were convicted of various offences. But good luck today, and thank you very much again. Jo Hamilton there. And let's take a look now at the weather forecast. Louise Lear has the details. Hello, this is BBC News with me, Anita McVeigh. A summary of our main stories for you. India has joined the UK's travel red list, with permitted travellers forced to stay in hotels on arrival as the country reports a daily rise of nearly 1/3 cases. Dozens. Time for some sport now. Let's head to the BBC Sports Centre. Hairdressers reopen in Northern Ireland. The risk of infection with coronavirus falls sharply after the first dose of a vaccine, a study finds, as the number of people in the UK who've received a jab reaches 33 million.